Hello, you are watching this video as you are going to have a planned surgical procedure in hospital, and you will need to take anticoagulants when you have been discharged from hospital. This means that you are eligible to take part in a study called GRACE, which is funded by the British government via the National Institute of Health Research and is sponsored by Imperial College London. You do not have to take part, but this short video may help you to decide whether you would be prepared to be a volunteer. Anyone having surgery is at an increased risk of developing a blood clot in their legs or their lungs. But doctors are well aware of the risks of blood clots in patients who have surgery, and they use a combination of anticoagulating drugs, sometimes called blood thinners, and compression socks to try to prevent clots from happening. You are usually given advice after surgery to stay hydrated and try to move around, which may help reduce your risk of getting a blood clot also. The NHS spends £60 million per year buying compression socks. They can often be uncomfortable to wear, and current thinking among doctors and researchers is that they are not needed as part of blood clot prevention plans. Anticoagulating drugs alone have improved so much over recent years that many feel they are sufficient. However, we need evidence to back this up.
Other research studies have also called into question the benefits of compression socks. The findings of the GAPS trial indicate that compression stockings may actually be unnecessary for most elective surgical patients, as do other research papers published in recent years.
So what do I need to do? Your participation is voluntary, you do not have to take part. If you do decide to take part, the research nurse or study coordinator will go through the patient information sheet and a consent form with you, which you'll need to sign to say you're happy with the requirements of the study. You can also do this via email or on the phone. The study starts at the time of your surgery and ends 90 days later. If you agree to take part, you'll undergo your planned operation, and a computer will decide whether you randomly receive compression stocks after your surgery, as well as a course of anticoagulants or blood thinners to take on discharge, or whether you'll receive anticoagulants on their own. Once this has been decided, it's important that you stick to the group you've been assigned unless there's a medical reason. If you receive the stockings, you should wear them for as long as you've been advised by your doctor, surgeon or nurse. And this is usually until you're able to walk around or until you've been discharged from hospital, but it might be longer depending on the type of surgery. If you're assigned to the no stockings group, you should not wear stockings at all during the hospital admission or beyond. Staff may be used to giving stockings to all patients after surgery, so if any health professionals do offer you your stockings, please do let them know that you're part of the GRACE study. You'll take your anticoagulant medication as prescribed by your doctor. This is for at least 5 days after you've been discharged from hospital, but it might be longer. Everyone who takes part in the study will be offered an ultrasound scan on their legs between 21 to 35 days after your surgery. The scan is not usually offered as standard care. It's an extra safety check for all patients taking part in the study. If any blood clots do develop after surgery, they'll be detected by scan and the doctor will decide whether any further treatment is required. Once you've had your surgery, you'll be followed up over the phone, via email or text message at 7 days, 21 to 35 days and 90 days after surgery. Follow-up is performed by a researcher at Imperial College London. If you decide to complete the follow-up over the phone, the researcher will call you at each time point and ask you a quick 2-minute questionnaire about how you're feeling. You'll return to hospital for the scan on your legs at 21 to 35 days after surgery. After the 90-day follow-up is performed, your participation in the study is complete.
The GRACE study needs around 8,000 patients to take part who are having surgery just like you. There may be no direct benefit to you in taking part in this study, but the results of the study may go on to improve the care of patients having surgery in the future. Thank you for taking the time to watch this video.